Measles outbreak in West Texas has now expanded across 3 states, with 2 cases now being reported in Oklahoma, 33 in New Mexico, and the total cases now in West Texas is 223. 2 unvaccinated people have died in Texas and New Mexico. I-Team reporter Brian New has been covering the trend of unvaccinated school children for nearly a decade. He joins us now with more.
So every time we take a look at these numbers, we see more North Texas school children skipping required vaccinations. Last year, nearly 4% of kindergartners filed the vaccine exemption. Researchers stress that keeping this number under 5% is crucial for herd immunity for measles, which makes it harder for the virus to spread. However, statewide numbers can be misleading. Our investigation found hundreds of smaller pockets with higher concentrations of unvaccinated children. Doctors warn that each of these is a potential outbreak waiting to happen.
Okay, I'll shuffle them.
When it comes to the health of her 3 kids, Liz Pignon told us last year she does not like playing the odds.
Good job.
Born at 25 weeks, the Pignon triplets spent much of their early life in the hospital. Even now, at the age of 12, their immune systems are fragile, which means certain vaccines, like the measles shot, may not fully protect them.
I'm always worried that if they get it, it's not like your average child. I know that it'll be like a stay in the hospital, or it'll be more detrimental to them, and it might shorten their lifespan.
Doctors say one key way to keep vulnerable children like this safe is to surround them with fully vaccinated children, creating a safety shield known as herd immunity. But the CBS News Texas I-Team has found over the years that this protection in many communities is diminishing. Texas law allows parents to file a conscientious exemption to the state-required immunizations. No religious or medical explanation needed. Just check, sign, notarize, and a parent can opt their child out. In the past decade, vaccine exemption rates have more than tripled in more than 100 Texas counties. Last year, 90 Texas counties, including Denton and Collin, were considered at high risk of a measles outbreak because the vaccine exemption rate for kindergartners exceeded the 5% threshold needed for herd immunity protection. In Gaines County, the epicenter of this latest measles outbreak, last year nearly 18% of kindergartners filed a vaccine exemption.
That family, they've been a little worried about vaccines in the past.
Dr. Alice Phillips is a pediatrician at Cook Children's Hospital in Fort Worth. We shared with her what other pediatricians have told us over the years about their concerns about potential measles outbreaks. So over the years, we've talked to these doctors, and they've told us things like, it's only a matter of time
that we reach those thresholds at which we can expect outbreaks of vaccine-preventable diseases to occur.
Another doctor told us the biggest concern
as a pediatrician and as a parent is that we're going to start to see outbreaks of these diseases.
It seems like doctors have seen this coming.
We have. We hoped it would not. We hoped that we could continue to message and to educate and to turn that tide, but we've been concerned about this for a long time.
Do you feel like people aren't listening to the warnings?
I think they're listening. I think they're facing a lot of challenges. When you consider what drives vaccine hesitancy, it is multifactorial. Lots of reasons people choose not to vaccinate.
For years, groups like Texans for Vaccine Choice have advocated for the rights of parents to choose whether their children get their school immunization shots. Their efforts became more mainstream when they took on COVID vaccine policies. Doctors say this has led to more parents rethinking longstanding school vaccines.
I think what we have to focus on is that we both have the same goal. We both want their children to be safe and to be healthy. And they're trying to balance what they may hear on the internet, on social media, with what we're telling them, which is very complex science, and they're trying to understand it.
I am worried about their classmates not being vaccinated.
Pignon says she worries that this trend will continue and thus put her kids at greater risk. Do you think the trend will change?
I think it will, but unfortunately I think it's going to take a long time. I don't think a single outbreak a single year that we have a lot of cases will likely change everyone's mind. I think that it will take many years of dealing with this.
In an extensive investigation last year, we filed dozens of public records requests and found that parents who choose to file vaccine exemptions often cluster together. They live in the same communities, attend the same churches, and send their kids to the same schools. This clustering has put more than 240 schools here in North Texas at risk of a measles outbreak. 160 of these are public schools and 80 are private. Ken, at all of these schools, the vaccine exemption rate has reached that crucial 5% herd immunity threshold.